A new month, Juneteenth. So if you would give generously to that. And with that, if there are no other announcements, I would invite Vern back to the podium to introduce today's program.
Thank you. This cup money thing is something I wish I had designed a long time ago as a fundraiser. This is the easiest fundraising I've ever seen. It's a pleasure for me to introduce Steve Coen, the president and CEO of the Kansas Health Foundation. Steve has served that role since August of 2008. Since joining the Health Foundation in 1987, he has held a number of different positions, including Director of Public Affairs, Senior Program Officer, and Vice President for Administration. I feel like it's important to mention a little bit about what the Kansas Health Foundation has meant to the community of Manhattan. The Health Foundation has given over 180 grants totaling more than $13 million to this community over time. So it's a major effort. More importantly, and more closely from my end of the spectrum, the Community Foundation has been a major benefactor in the Health Foundation, especially when it first started in 1999. It really got kicked off with a challenge grant, but for various efforts of operating support, children's fund, public health programs, schools, healthy lifestyle initiatives, they've given to the Community Foundation almost $2.5 million over the time, so it's been a significant factor. Before working with the Kansas Health Foundation, he served as a legislative assistant to Senator Bob Dole in Washington, D.C., and state director of his 4 Kansas offices. In addition to his professional experience, Steve has served as chair of the Governor's Council of Fitness and as a member of the Leadership Council of the Greater Wichita Economic Development Committee, or Coalition. Steve's idea to develop physical, active, healthy lifestyles courses in high school students earned him a national award. He also received the 21st Century Community Champion Award given to individuals who have made a significant contribution towards strengthening families. He received his undergraduate degree from Emporia State University and his law degree from Washburn University. Please join me in welcoming Mr. Steve Coen.
Thank you, Vern. It's a pleasure to be back in Manhattan. Sherry Westhoff from our communications office and I are both pleased to be here. I've been in Manhattan many years over my life. As Vern mentioned, I worked for Senator Bob Dole, and so I was in Manhattan many times with the senator and his staff and others, Elizabeth Dole as well. And then also I'm spending a lot of time here recently. I have a son here who's a sophomore at K-State, so I get here a lot to see him as well. So it's a pleasure to be here again. I appreciate you having us. As Vern mentioned, I'm here representing the Kansas Health Foundation, who also has had the pleasure of doing many partnerships with the Manhattan community to improve the health of your citizens and work with us to improve the health of all Kansans, which is the mission of the Kansas Health Foundation. For those of you who may not know much about the Kansas Health Foundation, the Kansas Health Foundation was formed from the sale of Wesley Medical Center in Wichita. That hospital was sold in 1985. It was a United Methodist hospital. It was formed by the United Methodists, and the Board of Trustees made the decision in 1985 to sell that hospital to create this foundation for the state of Kansas. We received the assets from the sale of that hospital, which was about $200 million, and those assets were invested, and from the earnings of those assets, we made grants across the state of Kansas to improve the health of Kansans. We distribute about $20 million a year in grants. Those assets have now grown to about $500 million, which is fortunate. And over our history, we've given away about $500 million in grants. So it's a great asset for Kansas. We're the largest foundation in the state of Kansas. It's a wonderful thing for the state of Kansas. Today, during my time with you, I'm going to highlight 3 things. First of all, I'm going to talk about the state of health in the state of Kansas. Then I'm going to share a little bit about the Kansas Health Foundation's work over our past 30 years of history. And then I'm going to talk about our vision at the state of Kansas to create a culture of health in the state of Kansas. First, I'll talk about the difficult news. And unfortunately, by many accounts, Kansas is getting very sick. I don't know if you've heard, but the latest health rankings put out by a national organization called the United Health Foundation shows that Kansas has slipped from the 8th healthiest state in the nation to the 27th healthiest state. And if you can see, up here on the video monitors, we're going to show you some of that information and point out what has brought us to this point today. This report doesn't just measure traditional healthcare indicators. It takes into account some other things like unemployment rates, poverty rates, educational attainment, those kind of things. And all of these things, as we know, can have a huge impact on the health of the people of our state. On this next slide, and I'm sorry it's very small on these screens, but on the left-hand side of this slide, it shows some of the states that are doing really well in our country. And at the top of the list, the states that are at the very highest ranking are Hawaii, Vermont, Massachusetts, and then down lower on the list, there at number 8, where Kansas used to sit in 1991, is the state of Colorado. It's really sad to me to think that's where we used to be, and then over on that far right-hand side, there sits Kansas today at 27. So what has brought us down to this point? There's a lot of indicators actually that have brought us down, but we've taken a close look at some of the major things that have brought us down. And 2 of the major points that have really helped us slip show up on this next slide, and they relate to child outcomes, children's health, and also tobacco use in the state of Kansas. Some of the other states have taken the money that they received from the master settlement. I don't know if any of you remember, but several years back, we got a bunch of money from the state settlement for tobacco companies. That money was really intended to be used to put in tobacco prevention, to drive down tobacco use rates. We're spending $1 million out of the huge amount that we get each year for tobacco prevention in the state of Kansas. A lot of the other states have put a lot of that into trying to prevent children from smoking. We don't do much with that money. $1 million a year isn't very much to put into it. They recommend that we at least spend about $27 million a year of that money to prevent kids from smoking. Unfortunately, because we're not doing that, other states are having are doing much better in preventing kids from smoking. And so we're not keeping up with the other states. And so our rates are not dropping like the other states are. And tobacco use has a huge impact on health. Huge impact, because it leads to heart disease, it leads to lung cancer, it leads to all kinds of other diseases that cost a lot of money. Also related to child outcomes, we're really slipping in a lot of ways. Kansas has one of the highest rates of infant mortality in the entire nation. Is that surprising to all of you? It's really surprising to me. And also our childhood poverty rates are amongst the highest in the country. The state of Kansas. Isn't that shocking to all of you? It's shocking to me, and it's very sad. Now let's look at some of the recent headlines that deal with some of these issues. The headline on the left-hand side talks about our schools struggling with the growing poverty rates in the state of Kansas. A real indicator of poverty rates at our schools is free and reduced lunches. Kids that are getting free and reduced lunch. Just to give you an indicator of where we stand in the state of Kansas. Schools in Kansas like Kansas City, Wichita, Salina, Topeka, Liberal, Dodge City, Garden City have rates now 70% of their kids get free and reduced lunch. Hutchinson, Winfield, Junction City, Great Bend, over 60% of their kids have free and reduced lunch. That is really becoming the norm in the state of Kansas. Now here in Manhattan, I'm pleased to tell you, you are by far the exception to the rule. 40% here in Manhattan. That is really unusual. So you have something to be proud of here. Something's going on right here. But across the state, we have really high rates of free and reduced lunch. That has skyrocketed over the last few decades. So we really have a real high growing poverty rate in the state of Kansas. Now let's go back to the tobacco issue. We are spending more than 200 times treating smokers than we are investing in prevention. We are spending $200 million a year treating tobacco use related diseases on Medicaid alone in Kansas. That's 200 times more than we are putting into prevention. It's estimated that it costs us $1 billion a year treating tobacco related disease in the state of Kansas. $1 billion. That's all preventable. Just keep people from smoking. So it's really shocking how much we're spending related to tobacco use. It's the leading preventable cause of disease and disability in our population. So we really need to be addressing it. So really, all of this, there's lots of reasons behind all these rankings, but a lot of it really relates to decisions that we're making in Topeka every day. We're cutting back on a lot of things that are having results that lead to these rankings. But anyway, it's not all bad news. I mean, before we talk further about how we're going to begin to address some of these problems, I want to point out some of the bright spots in the rankings. Kansas is ranked 5th for graduation rates in the United States, and that's something we ought to all really be proud of. We're doing really well in the education realm in Kansas. Now, it does worry me about some of the discussion that's taking place now about education. We don't want to slip. We're doing really good in education in Kansas. Public education is doing a really good job. And we're ranked 11th for employment in the nation. Our unemployment rates are really low in Kansas, so we need to keep that going. Also, physical activity amongst our population has grown from 40th in the nation to 28th. So something's going really good about how we're getting more people physically active in this state. And we're proud of that at the Kansas Health Foundation because we've worked really hard in investing in that across the state. So something's going on good in that area. This year, the Kansas Health Foundation, as I mentioned earlier, we're celebrating our 30th anniversary. And as I mentioned, we're proud that we have distributed over $500 million in grants since we were first formed. I want to just touch on a little bit of some of the things we've done over our history. One of the key roles that we've always felt like is important for us to do since we were created is trying to figure out what are some of the gaps that are preventing Kansas from becoming a healthier state, healthiest as it can be. And I want to just touch on some of the few things that we have done over our history to identify some of those gaps. Early in our history, we heard from communities like Manhattan and other communities in the state that a new generation of leaders was not coming forward to address the health issues in our communities that were existing, and that they did not have the skills that they needed to address those issues. So as a result, we developed a series of leadership programs that we ran and helped roll out across the state. Then in 2006, our board decided that we should create a new leadership center focused on building leaders in our state. This is a picture of the center that we just recently built in downtown Wichita about 3 years ago. Every year we're putting out about 2,500 people that go through the center with leadership skills. We're partnering with programs like your leadership program here in your community and others across the state. The goal of that leadership center is to foster civic leadership for stronger communities across the state of Kansas. For those of you who don't know much about the Leadership Center, their site is up there, website www.kansasleadershipcenter.org. They provide free leadership training for nonprofit centers, nonprofit organizations across the state, and if you would like to find more about that, you can go visit their website. Also, early in our history, we found a gap that existed in health data and information for the state. We just didn't have basic information in the state about such things as how many uninsured do we have, how many underinsured people do we have in the state of Kansas. Just basic health information for our state, for our policymakers to make decisions. So we created an organization called the Kansas Health Institute that is based in Topeka. This is a picture of their facility that's just north of the Capitol. They put out those kind of reports on an ongoing basis to help inform our policymakers. Nonpartisan, non-biased information. They did a study when Lawrence was our first community to pass a smoking ban. They did a study on did that have an impact on restaurant and bar sales, and we knew it wouldn't have any impact, but they put out a study. Sure enough, it didn't have any impact. So when our state was considering doing a statewide smoking ban, we could provide that information to our state policymakers and say, guess what? It didn't have an impact in Lawrence, it won't have an impact statewide. And so finally in 2010, we got a statewide smoking ban passed, fortunately. Their research has also informed us recently that the big impact that expansion of Medicaid can have for our state. And we know that it will have a huge impact. 150,000 people would be insured in our state if we expanded Medicaid. And the studies show that it would be people, mainly working poor people that work in the restaurant industry, that work in the hospitality industry, people that work in the healthcare industry, mostly working poor people that really could benefit by having health insurance. And so we are supporting the expansion of Medicaid in our state, and we hope that you would support that as well. We think it would be a great thing for Kansas, It's shown that it would save money, it would work really well, and we're passing up a great opportunity in our state by not supporting that. Also in our early years, we discovered a variety of health professions gaps in our state. So particularly in rural communities in the state of Kansas. So early in our history, we supported the development of a nurse practitioner program. Now we have nurse practitioners all over Kansas, but at that point in our history, we didn't have that program in Kansas. So we started that program on 5 different campuses in Kansas. We now have nurse practitioners in nearly every county in the state of Kansas. Today, we have an oral health crisis in Kansas. We know that many dentists are going to be retiring. Baby boomer dentists are going to be retiring. We already actually have a dental shortage in the state in many rural communities. So we're supporting the development of a mid-level in the dental field called the registered dental practitioner. This would be a dental practitioner that could do simple cavities, simple extractions, kind of like a physician assistant or nurse practitioner, but in the dental field. So we're trying to convince the legislature that this would make sense in Kansas. Well, they have this kind of practitioner in Alaska, Minnesota, Maine, Vermont just approved it. So we're trying to bring that model to Kansas so that we can meet that need. One thing that we have learned clearly over the history of the Kansas Health Foundation is that building a culture of health really supports health in Kansas. And that is about changing policies so that we can create an environment where health is really the norm. I'm wondering if some of you, particularly the older people in the room, remember when there were ads on TV supporting smoking. You know, I remember actually even when doctors were in commercials on TV promoting smoking. And that this room would have been filled with a smoky haze. There would have been ashtrays on the table. You know, smoking was the norm. Now it's hard to, now that isn't around anymore. That really is building a culture that supports health. People don't smoke anymore because nobody else smokes anymore. You know, it's just, we have less smoking because of that. That is building a culture that supports health. And that's what we're trying to do at the Kansas Health Foundation. Change the culture that supports health. Today, one other way that we're trying to do that is by raising the tobacco tax in the state of Kansas. We know that if we raise the tobacco tax, less people will smoke. Kids won't be as likely to smoke because it's more costly. And we know it's been proven in other states that as the price goes up, less people smoke. So those are the kind of things that we're trying to do is build a culture that supports health in the state of Kansas. Another example of building a culture that supports health, whoops, I'm running out of time. Another culture that supports health is by changing the norm around healthy eating and active living. And you have a really good example of that going on in your community that we are supporting. And that is with your Healthy Communities Initiative, where they're trying to build more bicycle lanes. They're trying to change vending machine ordinances in your community so they have more healthy options in your vending machines, tobacco-free parks. That's all building a culture that supports health. So it's easy to do healthy things in your community. That's another example of where we're trying to build a culture of health in your community and other communities. Actually, we're working in 19 other communities in the state of Kansas to build a culture of health. We're also walking the talk at our own organization. We have policies that we've implemented at the Kansas Health Foundation where we do not serve fat-filled meals. We don't serve soda at the Kansas Health Foundation anymore. That is building a culture of health so that people get used to living a healthy lifestyle. And that eventually leads to healthy eating and active living. And I think that really is starting to happen actually across the nation. If you've read the Wall Street Journal or other national publications, soda companies are starting to feel the effect of what the consumer is demanding. Their profits are going down. Also, the fast food industry is feeling the effect. Consumers are demanding different products now. The culture of health is changing as far as healthy eating and active living. And that is what we're trying to do at the Kansas Health Foundation, is to support that movement. We are proud to have partnered with you on many efforts in this community to build a culture of health. And we hope that we can continue to partner with you in the future. We believe in your community. We believe in the state of Kansas. We all want to build a culture of health. We are proud that we have partnered with you in the past. We want to partner with you in the future. Thank you. We're trying to get at that.
Question?
Why is infant mortality so high in the state of Kansas? We're trying to figure that out. We've been funding efforts across the state in communities that have really high rates. Topeka, Junction City, Wichita, Kansas City. We don't really know why. But we know we just have communities that have really high rates. Yes.
You've got little flyers here concerning recognition grants. Would you like to say something more about?
Yeah, that's most of the initiatives that we do are kind of more proactive. You know, we're trying to identify what are the leading health problems in Kansas and then bringing models to Kansas or initiating programs with agencies and organizations that we believe can make change happen. But our recognition grants are what we call our more reactive grant making program. We do 2 cycles a year, March 15th and September 15th. We give away about $1 million in each cycle. It's a very open process. It's a very simple to apply for process. You can find the grant application on our website. People tell it's the easiest grant application they've ever filled in. It's an online grant application. And really, it's just anything to improve the health of Kansans. The sky's the limit. Grants are up to $25,000 each. We have a review committee made up of people from across the state of Kansas, like, you know, maybe somebody from your university, a nonprofit, you know, in another part of the state. There's 5 people that review it. And we usually get about 150 grant applications per cycle, and we usually give away 60 or so grants per cycle. They rank them based upon how they review them. And there's some criteria on the website, kind of gives you some general ideas of what they look for, but it's pretty broad. We all kinds of different projects get funded. So your chances are pretty good, obviously. Yes, Ron.
Steve, I'm convinced that the investment you guys have made in the community leadership development through the years has had huge ripple effect across the state, and now, of course, the Kansas Leadership Center exists, so maybe it's not so directly related with it. Any comments you'd make about the importance of the leadership?
Yeah, I mean, you know, a lot of people, I would say most people are kind of like, why are you investing in leadership? Yeah, that's probably the question I get asked most often. But, you know, if you don't have the capacity to make change happen, you can't make it happen. And I think early in our history, we heard from people when we'd ask them, why isn't change happening in your community? The leadership question just kept coming up over and over. And then also early on in our history, we did a review of our grants to find out which were the most successful grants and which were the ones that were most not as successful. And leadership was always the key ingredient. So that's when we really decided that we needed to invest in leadership. Yes. Oh.
Do you have any kind of direct programs in the high schools to try to convince young people not to smoke?
Oh, yes. We do prevention programs. We funded it through an organization called Tobacco Free Kansas that we've been the funder of for years. Yeah, we do. But there could be more. I mean, it's expensive. It's too bad the state's not investing more in that with those tobacco prevention dollars.
How many states have implemented smoking bans?
Oh, a lot. We are one of, it's over half at least, but we are one of the slower ones to come on. Yeah, it's pretty prevalent. Yes.
Kind of related, you mentioned the tobacco tax proposal, that increase that we're looking at. Any talk that you know of maybe taking some of those funds that are associated with that increase and then putting them towards a program like that? Seems like that would be a good idea.
We've tried to bring that up, but I don't think there's any. I think it's all going to go towards the budget. No, I agree with you. That's not the motivation. We brought it up, but I don't think